I got started in this line of work the hard way. As a patient, discovered that. I spent nearly 13 years in radio and also playing in various bands and hurt my voice a couple of times and just sort of discovered this profession as a patient originally back in the early 90s and just really fell in love with the whole concept of voice science and vocal pedagogy and voice use and how the instrument really works, how to help it work optimally.
I always sang growing up and became really interested in studying singing privately at the high school level. Thought about going to conservatory for singing for undergrad, and then I finally went to school and got a master's of music and opera performance. You know, I always had sort of a caregiver personality, so I wanted to see how I could incorporate that into my singing life, and really found that this was the perfect marriage of my love for singing and my love of helping people.
Right now I work mostly with people who use their voice to make their living in some way, whether they're singers or actors or teachers or broadcasters or litigators or lobbyists or what have you. Anyone who relies on a good healthy voice to do what they do for a living is who I see. When they get into any kind of vocal trouble, we bring them in a room like this and work with them to get the most out of their instrument in the healthiest way.
My goal is to get someone's voice back to where it was before they had an injury or an issue. I always like to work hand in hand with their voice teacher if they have one. And we always look at what we call coordination of respiration and phonation. So is there a breakdown somewhere in the system? So if the breath isn't working at its maximum, we try to get that working. If there's something going on, tension level in the larynx, we try to work on that. And we want to maximize resonance, which is the vibration someone feels in their face when they're making sound. So we always work on seeing how all those subsystems are coordinated and if they're well balanced.
Well, the symptoms we treat, the disorders we treat are certainly many and varied. People can end up with any sorts of various lumps and bumps on their vocal cords that interrupt vibration and make the voice sound hoarse, change the quality. For a lot of people who use their voice on stage, for singing especially, they often lose their range. They lose the nice healthy timbre. They have small issues that only sometimes they can pick up, that the audience won't pick up, because a lot of singers especially are very in touch with their instruments. So they can tell us, even if you can't overtly hear something, they can tell us what their problem is and we can start working with them on a very specific issue.
I think our center is pretty special because we have a unique opportunity to work hand in hand with our laryngologists. So we see patients together when they come in for their appointments, and we kind of decide together if it's a combination of therapy, medicine, potential surgery, you know, looking at the intersection of those to see what could best serve the patient. And then as they come for therapy, we have this lovely music room which is unparalleled and offers opportunities for people to play the guitar, play the piano, record themselves to really simulate what a performance-like setting might be, or even a recording type setting, so they can get that real-time feedback with the instrument they use.
The voice is not something that we have. A voice is something we do. It's a verb. And a lot of times the doing of voice is sometimes such an overdoing, and in some cases it's an underdoing. So we have to find that nice neuromuscular cooperation to get the instrument to work optimally without too much pressure. And so the vocal cords vibrate smoothly and robustly, and the voice quality is as good as it can be.